Cancer doesn't knock on the door before entering your life. It comes silently. No warning, no sound. No pain in the beginning. Just one damaged cell. One small change inside the body. A change so tiny that no one can feel it. And then slowly days become months, months become years, until one day a doctor says a word that changes everything: cancer. But here is the painful truth. Sometimes the things that increase its risk are already part of our everyday life. The food we eat, the smoke we breathe, the habits we repeat, the things we ignore. Today's video is not just another health video. This is awareness. This is prevention. This might be the information that protects your life or someone you love. So watch till the end, because one of these risk factors is something most people do every single day. Today we are talking about one of the most important health topics: what things increase the risk of cancer. Before we begin, remember one thing: having a risk factor does not mean a person will definitely get cancer. But these things can increase the chances. And when we know the risks, we can make better choices. So let's begin with the most dangerous one. Part 1: Smoking, the silent poison 2. First and biggest risk factor is smoking. Many people start smoking casually. Just one cigarette with friends. Just one puff to reduce stress. Just one habit to feel normal. But that one slowly becomes many. And every cigarette brings harmful chemicals into the body. These chemicals travel into the lungs and bloodstream. Over time, they damage healthy cells. When these cells are repeatedly damaged, they may begin to grow abnormally. This is how cancer risk increases. Smoking is strongly linked with lung cancer, throat cancer, mouth cancer, bladder cancer, but the sad part is it does not only harm the smoker. The smoke in the room also affects family members, children, parents, spouses. Even secondhand smoke can be dangerous. So sometimes one person's habit becomes another person's risk. Pause here and think: how many people around us still think smoking is harmless? Part 2: Food that slowly damages health. Let's talk about something we all deal with every day: food. Food can heal the body, but it can also slowly harm it. Fast food, fried snacks, processed meat, sugary drinks. These foods may taste amazing, but when they become a daily routine, the body starts suffering. Excess oil and processed ingredients can lead to obesity and chronic inflammation. And long-term inflammation may increase cancer risk. Many people also avoid fruits and vegetables. That means the body gets less fiber, vitamins, and antioxidants. These nutrients help the body repair damaged cells. Without them, the body becomes weaker against harmful changes. This is why diet matters. What we eat today becomes our health tomorrow. Part 3: Obesity and no exercise. Today many people spend hours sitting on phones, on laptops, watching screens. Days pass with almost no physical activity. When the body stops moving, health begins to decline. Weight increases. Hormones become imbalanced. Inflammation rises. And this may increase the risk of several cancers. Exercise is not just for weight loss. It helps the body stay active, improves immunity, and supports healthy cell function. Even a 30-minute walk every day can make a difference. Sometimes prevention starts with something as simple as walking. Part 4: Pollution and harmful chemicals. Let's talk about a danger many people cannot avoid easily. Pollution. The air around us may look normal, but invisible particles can enter the lungs every day. Traffic smoke, factory fumes, dust, chemical exposure. People living in crowded cities are often exposed daily. Over time, this can damage the respiratory system. The scary thing is pollution damage happens slowly. A person may feel fine for years, but the body may already be suffering. For people working in factories, salons, farms, or industrial areas, chemical exposure can be even higher. This is why masks, ventilation, and safety precautions matter. Part 5: Sun exposure. The sun gives light and life. But too much sun exposure without protection can damage the skin. Especially people who work outside for long hours, farmers, laborers, delivery workers. Repeated UV exposure can slowly damage skin cells. Over time, this may increase the risk of skin cancer. Using sunscreen, caps, and protective clothing is important. Small protection can prevent long-term harm. Part 6: Stress and lack of sleep. Let's talk about something modern life has normalized: stress. Constant pressure, overthinking, anxiety, sleepless nights. Stress itself may not directly cause cancer, but long-term stress weakens the body. When sleep becomes poor, the immune system also becomes weaker. The body repairs itself during sleep. Without proper rest, the body may struggle to repair damaged cells. That is why sleep is not laziness. Sleep is healing. Part 7: Family history and genetics. Sometimes risk comes from family history. If close relatives had cancer, the chances may be higher. This does not mean it is guaranteed. It simply means awareness and regular checkups become even more important. Early detection saves lives. Cancer risk is often built by years of small habits. Small things we ignore. Small choices repeated daily: smoking, poor food, no exercise, stress, pollution. The good news is this: many of these risks can be reduced. Better food, more movement, less harmful habits, regular medical checkups. Sometimes a healthy life begins with one decision. One small decision today can protect years of your future. So ask yourself, what habit will you change after watching this video? If this video helped you, like, share, and subscribe, because awareness can save lives.